This program is for informational purposes and is to be used along with the instructions provided by your physician. An asthma action plan will be given to you on discharge from the hospital and updated at your child's doctor's visits. A good asthma action plan prevents trips to the ER and hospital stays. When you have multiple medications, it can be confusing to know when and how to use each one. Your asthma action plan will help you keep them straight. Your asthma action plan has multiple zones. The green zone is when your child is healthy with no signs of coughing, wheezing, or chest tightness. This zone may include daily medications such as a controller inhaler, a nasal spray, or an allergy medication. The daily inhaler or nebulizer treatment is an inhaled steroid and helps keep inflammation in the airways down. Be sure your child rinses his or her mouth and washes his or her face after using the inhaled steroid to prevent yeast infections in or around the mouth. These medications should not be stopped without consulting your doctor. Make sure to refill these medications at your pharmacy. Keep taking these controller medications even if your child has no symptoms or seems to be feeling better. You may stop these medications when your child's pediatrician or pulmonologist recommends stopping. The early yellow zone is when your child might have a dry or nighttime cough. You might see breathing faster in younger children or breathing deeper in older children. Start your quick relief medicine per your asthma action plan. This quick relief medication is normally albuterol. Quick relief medications relax the muscles around the airway to open it up so the child can breathe better. The late yellow zone is when the airways start to narrow. There will be more reaction, more swelling, and more mucus production. Their dry cough becomes persistent. Your child might start to have retractions. They might be breathing faster or have an expiratory wheeze. Follow your action plan medications. Call your doctor if the wheezing or respiratory distress persists despite treatments with your quick relief medication, or if your child is consistently requiring treatments more than every 4 hours at home. The red zone of your child's asthma action plan is a very late stage of an asthma attack. This can be very severe and life-threatening. Your child's airways are blocked with tightness, mucus, and swelling. Your child might not want to eat, drink, talk, or walk due to difficulty breathing. Their retractions are going to be worse. They may breathe from their belly. You might see their nasal passages flaring. They may have a look of distress on their face, or sitting in a tripod position with their hands on their knees, leaning forward. Wheezing might be quieter because there's no air moving through their lungs. This is a late and very dangerous sign. This is an emergency. Rescue medication might not be working. Follow your red zone of your asthma action plan and either go to the ER or call 911 immediately. Here's a few asthma tips to follow. Call your doctor if your child needs a breathing treatment more than 2 times a week or has a nighttime cough more than 2 times a month. It's a good idea to keep track of these treatments or events on a calendar so you can share this information with your doctor. It's very important to keep all of your follow-up appointments. Use your preventative medications every day and keep your medications refilled so your child doesn't run out. Now you know the stages of an asthma attack and how to treat the symptoms. Remember to always take action early. Start as soon as you hear a dry cough. Don't wait until you hear wheezing to start treatments. Use your asthma action plan every puff, every time. With good asthma management, using your asthma action plan, your child should have reduced ER visits and be able to do the activities he or she enjoys.